Hi, my name is Nazanin Moghadnami and I'm a queer Iranian immigrant living in the lands of Muslims, Squamish, Tsleil-Waututh, and Coquitlam people known as Burnaby. I have extensive personal and professional experience in working within the racialized communities here for the past 10-15 years, especially the queer and trans migrants and forcibly displaced people. As a mental health professional, as a clinical counselor, I see the ways that the systems of oppression contribute to our individual struggles and individual mental health issues that we have. And that is why in 2020, I ran in the provincial election, the first election that I could vote as a Canadian citizen with the BC Green Party. In the past 5 years, I've also been involved in advocating for the accessibility and availability of services to queer and trans refugees, in queer and trans refugees' healthcare and housing. I have been able to work with branches of the federal government, including the IRCC, to make IFHB in BC more accessible towards trans and gender diverse and LGBT refugees. And also I've worked locally and provincially with Transcare BC to make their services more accessible towards refugees, immigrants, international students, and other racialized communities. I've collaborated with BCCDC to make their material around sexual health also more accessible towards people of color, especially in regards to immigration status and legal status when it comes to disclosure of STDBIs, the sexually transmitted infections that is known. Since 2023, after the uprising, the women's uprising in Iran, I've been also involved in community organization for Women Life Freedom movements in Iran, a movement that comes from the Kurdish women's resistance movement in Rojava, and from their fights against ISIS, known as Daesh. And that is a movement that doesn't see gender liberation, societal freedom, apart from environmental justice and equity. And that's a very big drive for me, as I also do not see liberation and anti-imperialism and climate change separate from our fights for equity and accessibility locally in Canada. I see them as systems that are intertwined together. In my work, because of my personal lived experiences, from what I have heard from the community and my professional experiences, I've realized there are gaps that in service and in society that might take a long time for them to be filled. So what I have been working on for the past year is to building a multidisciplinary comprehensive clinic, mental health and medical health clinic, that is dedicated to serving racialized communities in a way that is gender inclusive, trans affirmative, queer forward, and fat accessible here in the Lower Mainland. And I'm in the process of hiring people for that. I have been involved in powering refugees and queer people for the past 15 years. And I'm excited to learn from this program and be able to contribute in meaningful ways to the outcomes of this fellowship. Thank you.